All right, well, I think we'll get started. Good morning, everyone, and welcome to the Stanford Healthcare Nurse Residency Program application webinar. We are super excited to have you here today, so I hope you are just as excited as we are. My name is Christy Norris. I'm a nursing professional development specialist with Stanford Healthcare, and I directly support the nurse residency program. Before I get going, I want to share just a couple things. We will be recording this webinar, so that recording should be available by hopefully Wednesday of this week. And we will have a question and answer session following this presentation. So I'm going to ask that you hold all of your questions and refrain from using the chat during this discussion until that portion of the session. And so lastly, I'll share that this webinar is referring to important dates that are referencing our spring cohort in March of 2026. So first, I would like to take the opportunity to introduce the rest of the nurse residency program team. Carrie Zoss is our transition to practice director for the nurse residency program. In addition to the nurse residency program, she oversees the critical care transition to practice program, our acute care transition to practice program, and our oncology training program. Leticia Cortez is a nursing professional development specialist and program coordinator, and together we directly support the nurse residency program. And finally, Carly Dye is our HR partner and senior talent strategist supporting the nurse residency program. I'm excited to share that today we have 4 of our current nurse residents joining our session: Madison, Libby, Elise, and Heather. They will be able to share what made them successful in their application process when we get to the question and answer session later on. I'll also ask them to introduce themselves at that point and share again what made them successful. So before we jump into the nurse residency program itself, I'd like to highlight who Stanford Healthcare is for those who may not be as familiar with our organization. Stanford Healthcare is a large academic medical center with more than 300 facilities throughout the Bay Area. Stanford has the unique ability to adapt to our patients' needs. When outside of the critical care units, our acuity adaptable units, or AAUs, in the surgical, medical, and oncology areas care for patients from acute care, which is med-surg or 5-to-1 ratios, to intermediate care, or IIC, which is a 3-to-1 ratio. So for example, if our acute care patient becomes ill and requires more frequent intervention, and becomes an IIC or intermediate level patient, our AAUs are equipped to manage their care. Whereas with other models in other organizations, with patients with increasing needs will need to be transferred to an intermediate care level floor or unit. We are a magnet institution. This means that are committed to the highest quality professional nursing practice and healthcare outcomes. And we just received our 5th magnet designation with distinction just a few weeks ago. So we are also the only level 1 trauma center between San Francisco and San Jose. In total, Stanford Healthcare employs over 15,000 individuals, and of that, over 3,500 are clinical nurses. The Palo Alto campus has over 605 licensed beds, 101 licensed ICU beds, and 53 operating rooms. To get a sense of our footprint, the main campus is over 800,000 square feet. There are more than 450 live flight transports annually, over 100,000 emergency room visits per year, and over 2 million outpatient visits per year. We are a large, adaptable, high acuity specialty medical center. Now on to the nurse residency program. Our program is a recognized Vizient nurse residency program since 2006. Our residency program is a nationally accredited with distinction transition to practice program through the American Nurses Credentialing Center, the ANCC. The ANCC sets the standard for residency programs that transition registered nurses into practice settings. The residency program supports the successful transition to practice of newly graduated registered nurses each year into multiple clinical settings. Our overarching goal is our comprehensive 1-year program is really to develop compassionate, dedicated, and smart individuals who make a positive impact in the lives of the patients we care for. So I'd like to spend a few minutes sharing what it would look like to be a resident in our residency program. We get a lot of questions about what the first few months might look like or what to expect. Our program is 12 months in length. Your orientation with a trained preceptor will be a minimum of 12 weeks. Depending on the specialty area, that orientation time could be a little bit longer. In addition to your precepted shifts on the floor, you will complete online education and attend in-person nurse residency program seminars. The first couple of months will be twice a month. Then after month 3, seminar will be once per month for the remainder of the program. During these first few months in the residency program, you will participate in 3 unit-based education sessions. On top of that, certain specialties will have additional in-person or virtual educational sessions and workshops. This is all paid time and all part of your schedule. I share this with you so that you have a sense of how busy this time will be for you. If you're working night shift, you want to keep in mind that you will be attending most, if not all, of these sessions during day shift. Whether you're working on days or nights, this time of your life will require discipline with your personal life. So making sure that you are prioritizing yourself, your sleep, and incorporating things into your life and your schedule that bring you happiness will be very important. Depending on the specialty area you are hired into, there may be additional workshops, lectures, or education required that you will have to continue to participate in through the 12 months and beyond. For example, in oncology, at 6 months, those individuals are automatically participating in the oncology training program. For the next 9 months, they will attend training specifically related to chemotherapy certification. So I want to emphasize that we are a highly specialized academic medical center. So the patients we care for have increased needs, which means the nurses caring for them will have increased training and education. Part of how we meet our goal to develop compassionate, dedicated, and smart individuals is with our curriculum. The nurse residency program is a partnership between Vizient and the American Association of Colleges of Nursing. This curriculum was designed with the new graduate nurse in mind to support them during that first year of their professional career. The intention of this curriculum is to decrease nurse turnover rate, improve decision-making skills, and enhance clinical nursing leadership practices and promote the incorporation of research-based evidence. So what our curriculum does is takes all of your background knowledge, all of your skills and experience, and really builds upon those. So connecting it and how it will be applied in the clinical setting as a nurse, transitioning towards competency during that first year of practice. The key domains we focus on are leadership, professional development, and quality outcomes. How we integrate that, we'll discuss in a moment. Our program structure consists of clinical orientation, collaborative check-ins, program seminars, and an evidence-based practice project. So let's look at each of these just a little bit closer. The first layer is orientation. Nurse residents will receive over 350 clinical hours of orientation with a trained preceptor. We use a tiered skills acquisition preceptor model. We call it TSAM. Each tier builds on the previous. Essentially, it's a progressive, incremental skills acquisition model. So the resident moves from simple to complex care concepts. The resident will start with caring for all patients in the given assignment, but their focus will be on certain aspects of the care, such as vital signs or assessments. And then once the resident is competent in that tier, they advance and they assume more responsibility, building on the previous tiers. The specialty area the resident is hired into will determine the length of the orientation. Again, our goal is to safely transition the resident to independent practice. The second layer is collaborative check-ins. We follow the nurse resident with supportive and collaborative check-in meetings over the course of the 12-month residency program. A member of the nurse residency program team will collaborate with the unit leadership to follow the nurse resident's progress during the program to offer support when and where needed. We celebrate the successes and will help to identify areas of refinement. When necessary, we'll come up with an action plan to support the resident to be safe and successful. Check-ins are approximately 20 minutes in length and occur every few weeks throughout the orientation period. The third level or layer includes our program seminars. Seminars in person and at one of our education and training sites and facilitated by the nurse residency program faculty. We do not reteach nursing school concepts. Instead, we integrate that support your development and teach you how to apply your knowledge and skills at the bedside. Topics are aligned with the Vizient domains of leadership, professional development, and quality outcomes. Those include clinical reasoning series, prioritization, communication, resource management, escalation, managing error, a wellness series, and then we integrate teamwork and team building activities. The fourth and final layer to our structure is around the evidence-based practice project. All residents are required to complete a group evidence-based practice project. The EBP sessions support the development of critical thinking and clinical reasoning skills. Our project topics are aligned with the priorities of the organization and specialty areas. Residents are supported by the nurse residency program faculty and CNS or clinical nurse specialists, coaches throughout the project, and these are all happening during work hours. The projects are presented at the end of the residency program to the cohort as well as at the unit level. Depending on the type of project completed, it may be featured and presented in additional meetings throughout the organization. As a magnet institution, structural empowerment is a critical component to the growth of our workforce in our organization. We understand that individuals want to continue investing into themselves throughout their professional development opportunities. So Stanford Healthcare is uniquely able to provide nursing with many opportunities for professional development. We are committed to grow and develop our clinical nurses from the moment they enter the nurse residency program and throughout their career. Once the resident has reached 6 months of employment, they are promoted to a clinical nurse 2. It's at this time nurses have access to tuition funds that can be used towards formal education opportunities. Some of the opportunities available to them are being unit champions, participating in organization-wide committees, participating in mentorship as a mentee or maybe a mentor, and working on the clinical ladder promotion. A few questions we often receive is how many individuals we hired into the spring 2026 cohort, and that always depends. The area and number of residents hired fluctuates based on the available positions in the organization. Currently, we don't have a set number, but we do have the regions that will be participating in our spring 2026 cohort that starts in March. And I want to emphasize that this is subject to change based on the needs of the organization. Stanford is a specialty hospital, so the specialty regions for this cohort include oncology, surgical, and medical AAUs, in addition to float pool and clinical trials. Float pool serves the surgical, medical, and oncology AAUs. This is also where the training takes place. Depending on the needs of the organization on any given day, the nurse would float to that area in need. We'll talk about specialty preference in a second, but what I want to point out, there are regions that have more of an abundance of opportunity, such as the medical, surgical, or oncology regions, rather than, say, the float pool department. Float pool is potentially only hiring 1 to 2 residents, so the opportunity to interview for that department would be more competitive. Clinical trials nurses care for patients participating in trials. The patient may be admitted for something unexpected and are enrolled in a trial in the outpatient setting, or they may be enrolled while admitted. As you can imagine, in a large academic facility, patients can be undergoing clinical trials anywhere in the hospital with varying specialties. Similar to float pool, the clinical trials nurses are dispatched to surgical, medical, and oncology AAUs to care for these patients. When there aren't any patients admitted with clinical trials, the nurses will float to areas in need as supplemental staffing. I do want to take a moment to emphasize that this is not a research role. Clinical trials nurses provide direct care to patients receiving medical care and for patients receiving clinical trials. I share all of this with you so that you can make an informed decision about your preferences on the application. This is our cohort 44 timeline. Go ahead and take a picture of this if you'd like to. I want to point out some important dates on the application. First and foremost, our application will be posting on October 20th through October 26th. This application will only be open for 1 week. I also want to highlight that you will need to obtain your California RN license by January the 12th, 2026. You will notice that the licensing date is prior to our panel and unit level interviews. This is a change. We intentionally moved the date to ensure that candidates who are selected to interview have met all licensing requirements prior to their interview. In previous cohorts, we have allowed individuals to interview even if they have not obtained their license. This process was problematic at times. If a candidate was selected for hire following their interview but unable to obtain their license, then we were unable to fill their position. You will also note that our interview prep webinar will be held January 14th, 2026. We will post more information about this as it gets closer. Panel and unit level interviews will take place January 26th through February the 6th, followed by our final offers to human resources. And then human resources will be extending those final offers and moving potential candidates to clearing as employees. Our cohort 44 start date will be March 16th, 2026. All right, so you've heard a lot about our program. Let's start to talk about the application itself. So I'm going to walk you through the requirements. You must be a graduate of an accredited nursing program with your associate, bachelor's, or master's in nursing. We are often asked, can I apply before I graduate? Can I apply before I have my RN license? And the answer is yes, but just keep in mind of the important dates I just shared and that you must have your license by January the 12th, 2026. You cannot have more than 6 months full-time working experience as a registered nurse. That equates to 1,040 hours by the start of our program cohort, which is again, March. So if you do, you are welcome to apply to our clinical nurse 2 positions. Official graduation transcripts cannot exceed 18 months prior to the cohort start date. So that window for this upcoming cohort will be September 2024 through March 2026. Please use one name that remains consistent on all documentations, resumes, transcripts, and application information. For example, if on your transcripts it says that your name is Daniel, you'll want to use that name on the rest of your application documentation and the application itself. Lastly, we do not require clinical faculty references. A question we have been asked is if you've applied before, can you apply again? And the answer is yes. You just have to keep in mind the dates that we have been sharing. You might also be wondering, so what is all the required documentation? Let's go ahead and break that down for you a little bit more next. So the required documentation to submit a successful application is your transcripts, either official or unofficial. We recognize some of you are still finishing school. Just be sure that your graduation date is not greater than 18 months prior to the cohort starting. Again, the cohort starts March 16th, 2026, and that 18-month window is September 2024 to March 2026. You'll also need to submit a cover letter and resume. In the resume, be sure to include all of your work experience, not just any that might be nursing related. If you participated in a nursing internship or externship, include that. If you served in our military or have any volunteering experiences, please include those as well. In terms of submitting all of this information, we recommend that you have everything in one PDF or one Word document to prevent error. We understand that that may not be possible due to file size and that it won't upload. That's okay. This is simply a suggestion. So let's talk for a minute about a cover letter. A cover letter is really just a personalized introduction to who you are. It allows the applicant to really share with their potential employer their qualifications and the interest in the position they are offering. We use cover letters to get a sense of who you are and how you would use your experiences to accomplish the requirements of the position that you're applying for. So some things you might choose to share. Why you've pursued a career in nursing. So what motivated you? What have you done to get to this point? Or what makes you uniquely qualified for this role? There are a culmination of experiences that you have had. Personal experiences, clinical experiences, educational training, work experience, volunteer, military. There's a lot that goes into that. You might choose to share why you're choosing Stanford, why you're choosing a specific specialty, and what you're looking for in an organization. Maybe what you can offer an organization and how those values align. And lastly, what you plan to accomplish in the future. These are all just suggestions and things you can add. The main purpose of a cover letter is really to support the content that's within your resume. Your resume focuses on the qualifications and achievements and past experiences. Your cover letter expands on those achievements, showcases your personality, and explains why you'd be a good fit for our organization. It really just gives us insight to your soft skills, attitudes, and motivations. When everybody is coming in with similar education and training, take this opportunity to show us who you are as an individual and shine. We want to know what makes you stand out compared to others. So we get a lot of questions regarding cover letters. So I want to cover just a few of those. So we often get asked, how long should a cover letter be? Well, that's up to you ultimately, but one page should suffice. How should I address the cover letter? Or who should I address to the cover letter? You can address the cover letter to the hiring managers of Stanford Healthcare. Does Stanford read each and every cover letter, or do they use a software application to scan for words? We kind of wish we had some software to help us, but we do not. We read each and every cover letter, resume, application, and all the questions ourselves. Should my cover letter target a specific position or specialty area that I am interested in? Well, it's not necessary, but you absolutely can. For example, if you're interested in oncology, but you did not have a clinical that had that experience in there, and your resume doesn't directly reflect that, you can actually put that in your cover letter that you maybe cared for some of these patients in your med-surg clinical rotation. Or perhaps there's another reason that you're interested and this specialty is important to you. Should I share my work experience even if if it's not healthcare related? Absolutely. Working in retail or the food industry can lend to customer service, conflict resolution, critical thinking, time management. It's all translatable. And then should I share my senior preceptor even if it wasn't in adult medicine? Yes. And lastly, should I share what I think would be an asset to your organization, or does this come off as bragging? Share it. We want to understand how hard you've worked to get to this point and what makes you uniquely qualified. It's not bragging. So we get a lot of questions around resume formatting also, and what we want to see. So let's walk through an example. A resume provides a summary of your experiences, your abilities, your skills, strengths, and accomplishments. And it really provides that relevant information regarding your education, experiences, and job-related interests. So it demonstrates what you've done in the past, which really should be aligning with the qualifications of the role that you're seeking. Think of your resume as your personal marketing tool that allows you to effectively and clearly communicate your assets to a potential employer. So listed on the slide is a sample resume. How you wish to display and format this is really up to you, but everything listed here has to be there for us to review it and score it. So the areas scored on the application are around work experience, whether you've had an internship or externship, if you served in the military, and any volunteer experience. If you do, please ensure that you are including the hours that you have volunteered for. We also get a lot of questions on the resumes and cover letter, particularly around, again, formatting, length, and what should and shouldn't be on it. So if you think of a resume as an advertisement, it advertises you and your unique skills and qualifications. So keep it concise and be ensured to include all the areas that you see here on the screen. Some additional questions we get asked. How should I format a clinical rotation? You can put it in as a table, or you can have it just written out. Just be sure the information is there. I would also suggest that you bold any clinical hours in your desired specialty. For example, if you're interested in the medicine specialty, bold those clinical hours and call that attention out to the hiring managers. What do I put if I'm still completing my clinical hours? You can put that they're still in progress. Do we give any extra points for certain nursing schools or GPAs or degrees? We do not. Do you give any extra points if you've had a clinical at Stanford Healthcare? We do not. However, if you did, please make note of that. Make note of the unit as well. It helps us to know the specialty preference and choice if you put that on your application. And then also it's a consideration for us should you move on to a panel interview and where we might place you. Should I list non-healthcare work-related experience? Yes, absolutely. Is all volunteer work all volunteer work acceptable? And yes. What is considered an internship or externship? So an internship or externship is specifically nursing related. It's outside of your clinicals and capstone. It could be paid or unpaid, and you would have to apply for it. And there's always an end date. Should I provide my RN license information? If you have it, yes. Should I provide my ACLS and BLS? That's not necessary on your resume. Should you move through to the panel and unit level interviews and then be offered a position, human resources will ask you for that documentation. And then the last question we get oftentimes is, can I list other elements on my resume, such as skills, certifications, accomplishments? And yes, you can. However, please don't upload those as part of your application. We are not going to look at them, and the priority documents that need to be uploaded are your transcripts, your resume, and your cover letter. So let's talk about the application itself just for a moment. So the demographic information is going to be on there. And here, those are mostly yes and no's. It's going to ask you questions such as, where did you hear about this position? Would you be willing to commit to a 1-year residency program? And that you understand that you need to have your California RN license by January the 12th of 2026. It's then going to ask you your preferences. And there's an opportunity to list the areas that you would like to work in order of your preference. So we try to place people in their top choice. Depending on how quickly a specialty interview panel fills up, we may look at your second or third preferences. If you have a passion for a certain area, I would say to select that as your first preference. If you're unsure and open to different areas, keep in mind there are more departments interviewing in the medical, surgical, and oncology regions rather than float pool or clinical trials, for example. The opportunity to interview in those areas are more competitive, and there will be less departments looking at you. A question we often get asked is related to your specialty preference selections, and if only one interview in your preferred area will be offered. And the answer is yes. You will be only offered one opportunity to interview on a panel. On the electronic application, you will be required to answer 3 questions. Each question has multiple components, and you will be required to answer all components of the question. The length of that answer is up to you. We accept all answers regardless of length. We're going to go over the questions shortly. So we've discussed the required information scored in an application. And the next portion of this session will be important to you because we're going to talk about the application questions, and those have a great impact on the scoring. So let's look at this really quick. So on the electronic application, our recommendations are: ensure that all areas of the application have been thoughtfully and thoroughly completed. Ensure that all required documents have been uploaded. You can choose to do that in one PDF, so the cover letter, the resume, and your official or unofficial transcripts in one PDF, or you can upload those individually. So applicants who do not submit the required documentation will not be considered, and their applications will not be scored or processed. We also recommend that you create an account, and really this helps to enable you, the applicant, to go back after the application has been submitted and ensure that all of your documents have been uploaded, and that it enables you to also follow the application status. Now, it might take up to 24 hours for your application and documents to be routed and viewable, so be patient with that. If after 24 hours you don't see all of your documents, then you may email newgradrn@stanfordhealthcare.org with your documents no later than October 29th at 5 p.m. So we're also going to ask that you not submit multiple applications. And then lastly, don't wait to the last minute. Murphy's Law always kicks in, and you might think you have more time than you do. Your computer crashes, something always happens. So we encourage you to work ahead and submit them early. Let's talk about the application questions now. And I'd like to begin by highlighting that there are 3 questions included in our application. For those of you who have applied to previous cohorts, you may have noticed that that we have removed a 4th question. Additionally, we have made some modifications to the remaining 3 questions, so be sure to focus on the updated versions I'm sharing with you today. As you begin preparing for your application and start to draft responses to these questions, a good place to start is doing a brainstorming activity. Start by writing down some of your experiences and your scenarios that you could use as it relates to the questions being asked. As we look at these questions, you'll see that each question has multiple parts to it, so ensure that you are answering each part. The aspects of the questions we have bolded are what we are truly interested in. This is how we get to learn who you are as a person and as a nurse. The position you are applying for is an entry-level position. That means that each applicant is essentially similar, has essentially similar nursing experience. You will either have none at all or less than 6 months full-time experience working as a registered nurse. So the bolded aspects of these questions really help us to understand how you have grown, adapted to experiences, accepted feedback, and made changes to your practice. To help you answer this question, take time to reflect and ask yourself the prompts on the right-hand side. Why am I selecting this experience? How have you grown as a nurse? What's changed in your clinical practice? What have you learned? And why are you a better clinician for it? How much reflection and learning occurred as a result of this experience? What am I doing differently now as a result of this experience? Are you slowing down? Are you asking more inquisitive questions? Maybe you're being more mindful of nonverbal cues. What is it? How can I share and emphasize how I use this experience beyond nursing? So, how has this experience shaped you? And how do you enter interactions and conversations in other aspects of your life? How has this journey to this point shaped the way you think, act, or perform? And again, what has changed? What are you doing differently now? And then lastly, do I demonstrate a growth mindset? And is that evident in my response? Another tool to help you with answering these questions is how you structure them. Looking at the first question, as you prepare your response to that, there are multiple prompts that you may want to begin with. A time in my clinical practice I experienced a caring moment was, and then this moment affected the patient's outcome by, and then ending with a result of this experience with my practice has changed in the following ways. It's really this portion of the questions that we're looking at. And by setting up your answers in a format like this, it really helps to, one, ensure that you're answering all aspects of the question, and two, you're answering the question being asked of you and not what you thought you read. So let's look at this first one just a little bit more closely. I went ahead and broke it down so that you can see and have a visual of all three aspects of the question. The first question reads, tell us about a time during your clinical rotation when you experienced a caring moment with a patient. How did this moment impact your patient's outcome, and how has this experience shaped your nursing practice? Think back to your clinical rotations and pick out a couple different caring moments you experienced with a patient. Spend some time with the reflection prompts to the right and help so they can help you to choose the right experience to share. The second part of this question asks about the patient outcome. So tell us what happened. Did they express feeling calm, relieved, refreshed? What was it? Did you make them laugh for the first time in days? Maybe they have a sense of, or maybe you sense they had some underlying anxiety and uncertainty. Maybe they had a conscious effort to engage in this conversation about interests and hobbies, and then you noticed a shift in their mood and their eyes brightened. Maybe their shoulders relaxed. Tell us about that. Lastly, how has this moment changed your nursing practice? How do you enter a patient interaction or room differently as a result of having this experience? What did you learn? How is your viewpoint different? As you think about this, imagine you are sharing this with someone who wasn't there. Meaning, don't let us assume anything. Maybe you've incorporated some active listening or practice in patient-centered communication, or maybe just a conscious effort to find a common ground in your clinical practice. Tell us what this looks like for you in your practice and what things you have incorporated. How has your practice transformed? So this is the second question. And again, I broke it down so you can see all aspects of it. Tell us about a time you had an error in judgment. It can be personal, professional, or academic. What did you learn? And how has this experience shaped you into the nursing professional you are today? Just like the first question, think about some experiences you had in error, in judgment specifically. Walk yourself through the reflective prompts and help you structure a story that addresses this question that's being asked. Next, tell us what you learned. Did you learn something about yourself, about the person you were interacting with? Maybe it's about how bias can lead to assumptions, how slowing down can prevent errors. What was it? Be specific. And then lastly, how did this experience shape you into the nursing professional you are today? Sometimes for these questions, a candidate will share difficult feedback they received or a challenging situation that they may have had. They meant to share it as an error in judgment, but they don't actually share what the error was. We see this more often than you think. So, again, think about your sentence structure. When sharing how it shaped you into the nursing professional you are today, or how to demonstrate this, how do you ensure that you have not made another medication error? Or how do you ensure that you're not making assumptions during your interactions, or that your initial impressions can lead to assumptions? How do you apply the lessons that you learned to your practice, and how do you show up differently? For the last question, tell us about a time when you made a positive contribution to a community through service activities. These need to be outside of your clinical rotations. So, what lessons did you learn from this experience? And how has this experience influenced your approach to nursing care? So, just like before, brainstorm some community service experiences and ask yourself why these experiences are standing out to you. What is it about them? Did you learn something from it? Did you take something away from the experience? Did it impact an aspect of your life that you didn't anticipate? First aspect of this question is simply telling us about your community service. I want to emphasize that these experiences need to be outside of your clinical rotations. Then share with us the lessons you learned from the experience. Did you learn about suffering that only you'd previously read about? Did you learn about the resiliency that in the face of adversity? What was it? And lastly, how has this experience influenced your approach to nursing? How did you show up differently? How do you communicate differently? Do you approach situations differently? And do you have an example of it? Have you noticed any changes to your personal life and interactions that are a result of this experience? Maybe you can elaborate that and tell us what that means. So I hope that you have a better understanding of how to structure your questions and feel a little bit better prepared for these experiences. The last thing I want to share in regards to the application questions is we know that there's a lot of technology out there to help you, and that you may want to utilize this to assist you in answering your application questions. So I want to encourage you to not utilize this technology. What we have found is that answers generated through AI assisted platforms tend to be a little more general. We also see consistency between answers with other candidates. So while we understand why you may want to utilize these platforms, we recommend just spending some time to draft your responses to the questions yourself. We don't score any sentence structure or grammar. I also want to encourage you to reflect on your diverse experiences and the ones that you have encountered in your clinicals, and spend some time thinking about how to craft those authentic responses to these questions. So we know that you might have some additional questions. So the QR code up top is a QR link to our career site. And here you can find information about the program, clinical dates. And then if you scroll to the bottom of the page and click on the frequently asked questions link, it gives you some more information regarding resumes, cover letters, and questions that you may want to have asked. Then we're also excited to share that the Center for Education, Research, and Professional Development, also called CERP, also has their own Instagram and LinkedIn pages. I've attached the QR codes here as well as the handles so that you can scan them and then be updated on important news and announcements. All right, you're probably wondering a little bit about salaries, relocation, and benefits information. So the starting rate for a clinical nurse one is $89.20. That'll be in addition to any shift differential, depending on what shifts you're working. If you're working night shift, there's also an 18% differential. On the weekends, there is a 5%, and if you happen to be working an evening shift, there is a 10%. There's also a $5,000 relocation assistance benefit. You will have to be 120 miles outside of Palo Alto to apply for that. Paid time off, or PTO, you are eligible for that starting on the first day of hire. And then there are two additional things: absent time and extended sick leave. We have 3 comprehensive medical plans to choose from. One of those is employer paid. We have Stanford Healthcare Alliance, Aetna, and then Kaiser. We also have FSA and HSA accounts. And then you are eligible for tuition reimbursement, which is $1,800 per year, and those can go back to paying student loans as well. Some additional benefits are short-term and long-term disability, employer matching. So after 12 months of service, Stanford Healthcare will provide an automatic basic contribution, which is 5% of your eligible pay. And then there'll be some transportation benefits too, commuting, parking subsidies, pre-tax payroll deduction for parking permits, some transit passes, and then VAMPL as well. All right, so a few important reminders before we conclude. So your application checklist, you will need, again, transcripts, official or unofficial. Be mindful of that window that you need to have. Cover letter, resume. Make sure your resume has the education information we're looking for, list of clinical hours, experience, so work experience, military experience, internships, volunteer experience where applicable. And then you'll need to complete the electronic application. One last reminder, you will need to make sure that you have your California RN license by January the 12th, 2026. We're going to ask that you apply only one time. And if that you are concerned about an error, that's something to help into your application, just wait 24 hours, make the account that we suggested. And then if you don't see anything, email newgradrn@stanfordhealthcare.org to see if there was an error and if they can see all your application and documentation. Please be mindful of that application window and don't wait till the last minute. Late applications are not accepted. We're going to ask that you're consistent in using one name on all documentation and in the application, and that you double check that all of your required documentation is with your application. Otherwise, it will not be processed. And then last but not least, ensure that all 3 application questions are not only answered, but all aspects of each questions are answered. Don't leave anything blank. So with that, I just want to say thank you again for joining us today. And I'm going to transition to our question and answer portion of the webinar. So I'm going to stop sharing here in just a moment and ask our residents to go ahead and introduce themselves. I will call them out. Once they've had an opportunity to introduce themselves, you can use your virtual hand and I will call on you and we'll allow the residents to start answering those questions. If you have any HR specific or very specific program questions, you can put that in the chat. All right. So I'm going to go ahead and stop sharing here. Thank you. And I'm going to go ahead and have our residents share and introduce themselves, and maybe they can share maybe one thing that they found made them successful. Madison, I'll start with you first. Do you want to come off mute and introduce yourself, and then share maybe one thing that made your application successful?
Hi, everyone. My name is Madison. I am a new grad nurse resident in the adult emergency department. I think that something that made me successful in my application was really taking my time to read through everything. I think I did watch the application webinar probably multiple times, took notes, really made sure that I was paying attention to all details, looked through all of the FAQs, anything that was available to make sure that there wasn't anything missing and that I was able to utilize all resources that were available. And I think also I really wanted to work at Stanford. It was my dream to work here. And I think I was able to let that show in my application because I put in a lot of effort into my application essays, into my cover letter, into my resume, making sure that everything was kind of how I wanted it to be. And I think that it did end up showing in my application.
Thank you, Madison. And it absolutely did. I can verify that. Livy, do you want to go ahead and introduce yourself and maybe what made you successful, you think, with your application?
Yes. Can you hear me okay?
Yes.
Okay, great. Hi, my name is Livy. I work on D3, it's oncology unit. Let's see what made me successful. I remember vividly that, well, first of all, I went over my resume, my essay questions, everything multiple times. There were so many drafts and I would get lost in how many drafts I had done at that point. So that's okay. That is encouraged. But then also when I wrote my first couple of drafts, it came from the heart for sure. I had to get real with myself in terms of what happened during my nursing school, what was important to me. Because not only are you trying to work at Stanford, but you're also trying to match in terms of what do you want from Stanford too? Do you want to work at a place that's caring? Do you want to work at a place that supports you? Obviously, yes. And so I think that just being able to um, not be emotional when I wrote my cover letter and my essay questions, but pretty darn close. So I would say what helps me also is being in therapy and kind of discovering what was behind me as well. And I think that was evident in all of my answers and my whole process, and it kind of was well rounded in that way. And so I think Christine and Letty, they were able to see that, and that makes a difference, and that sets you apart from other people that maybe just writes their, what do they bring to the table in terms of academics? Be yourself.
Thanks, Libby. Elise, would you like to introduce yourself, please, and share what you thought made your application successful?
Hello, everyone. My name is Elise. I am also a new grad in the pediatric emergency department. And I think that what made me successful, I agree with both Maddie and Libby in that like this application is different from a lot of other new grad programs in that the essay questions don't ask about what skills you have or where did you precept, what did you learn, and more about like who are you and how does that impact your nursing philosophy and nursing practice like as at your core, which I really liked because I feel like it got to like show who I was beyond like all the resume accolades and things like that. So I agree, like just be honest in your applications, show your true self, um, and also, yeah, go over it a lot of times. I agree. Many drafts and a lot of like having other people read it, but I think if you can like hear yourself when you're writing these questions, then your true self will shine through and people at Stanford can see that. Yeah.
Great advice. Thank you. Last but not least, Heather, would you like to introduce yourself, please, and then share what you thought made your application successful?
Good morning. My name is Heather. I work on H1, which is ENT, plastic surgery, and chronic pain. And I agree with everything that's been said. I spent a lot of time on my cover letter and a lot of time on the essay questions. And one of the reasons I spent a lot of time is because it does ask for a lot of self-reflection. And that's not something that you can just, well, at least I couldn't knock out in an afternoon and be reflected. So it was a very iterative process, many drafts, and rephrasing and paying attention to those underlined portions of the question and really reflecting, how does this impact me? How did it change my nursing practice? How will it continue to change? And to Christy's point, that's not something that an AI model can do for you. And so I think it really does benefit all of us as applicants and as nurses to spend that time reflecting, and it does show through. And I also had many people read my answers, provide feedback. You weren't clear here, you could reflect here, you could develop this further. And that's really helpful, as well as just giving myself the time to come back to the question, maybe a couple days later. And there were times I realized, I don't know what I was saying here. And so it was an opportunity to revise.
I love that. All really great advice. Okay, so I recognize that there are a lot of people on this call, and we have about 40 minutes-ish or so. So what questions do you have for our residents? I'm going to call on you guys individually. I see that Catherine has her hand up. Catherine, do you want to come off mute and ask the residents a question?
Yeah, thank you, everyone, and thank you so much for hosting this. It's been wonderful. I'm curious if there's anything you would do differently now that you're on, the other side of the fence, whether that is in the application process or maybe the interview process, or maybe it's you know, you chose a schedule of nights and you're like, wow, this is not something that I can really do long term. So whatever that may land, however that lands for you, I'm just curious to know, you know, your own reflections of where you are now and what you would do differently.
Thank you for the question. Madison, I'll start with you. I'll just kind of go in a rotation to make it easy. Any feedback for Catherine?
I think since this is the application webinar, I'll kind of go off of anything that I might have done differently for my application. I think that there is never too much time to spend on this application if you really want it. I mean, I probably would have even started writing my applications and my application essays and drafting it out even earlier before it even opened. I was applying for this while I was in my last semester of my nursing program. So it did get really busy. And even towards the end, I felt, oh, did I spend enough time on this? So I would do that. Another word of advice I would say, which is something that I did do, and I think it did help me, is I went through and I read back all of my clinical journals. I know we really love writing those, and I think it actually really did help, and that even helped me in my interview. And it kind of sparked any sort of experience that I had that I could talk about. And even if it wasn't something that I wrote about, it could just remind me of some other experience. And I think I would tell everyone to really pay attention. Christy lays out the application questions, but pay attention to what is bolded. I would say spend more of your words and your thoughts on what did you learn from that experience. You don't want that experience to be this super complex thing that takes up the entire essay answer. You want to be thinking about, what did you learn? How has this impacted you? And really about how have you applied this to your clinical practice, and how will you as a Stanford nurse? So that would be my advice.
Thank you so much. That was great advice.
Thanks, Madison. Charles, I saw that your hand was up.
Thank you. This is more in response to something that Libby mentioned, but I think you all have answered to this. That's great. I'm curious to hear from your perspective, like, what does the support that Stanford provides, right, in the program, like, how does that feel like? Because you can hear that, oh, you have a preceptor, you have webinar, stuff like that, but like, how do you feel as, you know, a new professional going into this field? And if you've heard anything kind of relative to other peers or classmates that are in other, you know, new grad programs, other hospitals, like, how do you feel like Stanford is training you, preparing you relative to others?
Good question. Libby, do you want to take that one?
Yes, actually. Okay, so we've all worked other jobs, right? We have experience of what that support feels like. This is the first job that I have worked at that I've had instances where I'm like, oh my gosh, they are really behind me with this. For an example, we do unit or check-ins basically. And so I've now had 2 check-ins, and Leticia is for me. We talked about it briefly in the PowerPoint before about how you have people that are with you for your unit. And we talked about with my managers, the assistant managers, and my preceptor there. Okay, Libby, how are you doing? What are you struggling with? What are you doing well? And they really encourage you to think about what you're doing well, because we're all so critical of ourselves. And I felt like Leticia was my lawyer in that instance, because I was like, she can just back me up the entire time and I'll be fine and I can bring up whatever I want. Now, everything was great. I didn't have any negative things to say, but that is an instance where I was thinking, oh my gosh, I've never had a job like this before. And this is why, or one of the reasons you apply to this program, because of the support that you get. In addition to those check-ins, that's just a portion of it. We meet once a month with your cohort. So our cohort was 38 people. And just being able to like talk with everybody, so how are you doing? Are you struggling with this? Yes, I am having a terrible time, you know. But that's really nice just to have that camaraderie. And then in addition to that, we also have unit education, and that's a little bit more specialized. And that is super nice because, for example, me, I didn't have any experience with oncology. And so this was a whole new world for me. and having that space to learn, make mistakes, and have other people that are also going through all these new things with you is really, really helpful. So I hope that answers your question in terms of how you feel supported. They really make it apparent that they are there for you as well. You could always shoot them an email. I have Leticia's number, I have Christy's number. And so it really feels like a good time. I will also just add, this is all very serious right now. And I remember watching these back and thinking, oh my gosh, it's got to be cutthroat here. Day one, Christy and Letty, they're goofballs. And so we are just having a great time the entire time as well. So that helps.
Thanks, Libby. Letty and I try to, lighten the mood a little bit, I would say. All right, I see that Celeste has her hand up. Celeste, do you have a question for our residents?
Yeah. I was curious, you guys have talked a lot about sort of the support that you have, and that sounds wonderful. One thing I heard was that you might be given like an evening shift, and I was curious, maybe someone who has had an evening shift and then they had to do those day classes. I'd like to hear a little bit how you were able to make sure that you were showing up and being present, but also maintaining that balance so that you're not burning out your first year.
Good question. I think I was going to go to Elise next, but Elise, I think you're on days still, correct?
Right, yeah.
Yeah. Madison, you're doing nights, right?
Yes, so I am full-time nights for my shifts. And there's 3 other new grads that are in my cohort in the adult ED, and we're all on nights. So that is nice because we kind of are all in the same shifts and we kind of get to support each other and just say, oh, how's your night going? Everything like that. My unit education sessions with the adult ED, they do have it so it's 4 p.m. to 8 p.m. And generally that's on Tuesdays or Wednesdays. But what happens is if you're working nights, you can't be working the night before and you can't be working the night of. You need to have a certain amount of hours between your shifts. I've honestly felt like it's been pretty manageable. I have had experience with working day shift, evening shift, night shift prior to this job. So I felt prepared, but I do think that it is manageable and you're never going to be working over your 40 hours. Sometimes some weeks it's even less. And yeah, so I really don't feel like I'm struggling that much on sleep. I'm definitely getting enough sleep.
Thanks, Madison. I think that can be a very individual situation too. So I know we've had other residents that have struggled a little bit more with that. But I think going back to what I was talking about earlier, it's really that discipline with making sure that, like, if you know that you're working evenings or nights, that you are preparing ahead of time, having food in the house, knowing that you've got to keep to a schedule, and just that discipline initially. And to what Madison had said as well, we try really hard to make sure that you're not like having to flip in a 12-hour or even 24-hour period. So we try to make sure that you have that break. So, but great question. Stephanie, I see your hand is up. Do you have a question for our residents?
Hi, I do. I just want to say thank you so much for your time and thank you so much for having me. I just wanted to ask if any of the residents moved to the San Francisco area for this job or are not originally from that area, and like kind of what that transition was like.
Good question. I can't remember off the top of my head. Any of you have to move to this area?
Not terribly far, but I did go to school at Sac State. So I lived out there for a couple years. And I remember thinking like, I'm too far. They won't take me. I'm way too far. And my experience, and I did my preceptorship in the ICU, and there's no ICU spots. Like, just really like ruminating and
So I'll go,
overthinking
baby. I'll go and do it, okay?
whether
Okay.
Sorry, someone's got a hot mic.
whether it was like my location and like my experience would like match what Stanford was looking for. And if I could like tell myself like just apply, like it doesn't matter, just go for it because I think what they really care about is not necessarily like your unit, but like I said earlier, like your approach to nursing. And you're also a new grad, so you're very malleable. And like if you show your openness to learning, that's fine. So first apply, and then secondly, yeah, the adjustment has been different. I did move out here. Um, and it was a little bit harder to find like housing in the area. So I would say like as soon as you get that offer, start looking. Something I wish I did was like reach out to other people in my cohort and be like, does anyone else want to like, So I think there ended up being like a Facebook group or something. So for your guys' cohort, make that early so that you can figure that out together. But it's definitely possible. And it is a transition, but I think now that we've been working for like a month and a half, it's better that I moved rather than commuting and stressing myself out over that commute too. So yeah.
Got it.
Thanks.
Thank you so much.
Thank you. Christian, I see your hand is up.
Yeah, but quickly, I think Matthew has had his hand up for longer than me and a few other folks, if Matthew wanted to go first.
Okay, Matthew.
Oh, thank you. Thank you so much. So I just wanted to ask, like, what would you guys recommend new grads to focus on before starting the program, either like clinically or like personally, that would help better prepare for success in the program, I guess?
Okay, Heather, do you want to take that question?
Sure. I'll start with kind of the first part of your question for the application/interview cycle, and then a little bit once you start working on the floor. I think it's been said before, but taking the time to reflect on your experiences so far, both within nursing school, but also any previous professional experience that you had. And I think that's enormously helpful, and not only for the application process, but also when it comes to interview time. A lot of the interview questions will be asking about what did you learn? What did you do? What might you do differently? And so if you're already thinking like that, I think that will serve you well. When it comes to working on the floor, identifying what your support system looks like. And it's been mentioned that Stanford is an extremely supportive environment. It's a teaching hospital, and my experience is that culture of learning and teaching is incredibly pervasive. Um, I I think everyone is behind you, wanting you to succeed, and so that will be present within the workplace. But identifying before you start working who are my people, who can support me personally, and if I had a long shift or a difficult shift, is there someone who will comfort me or remind me that um, like my identity is not tied up in only what I can do at work or what I did today during this shift. I think that's been incredibly helpful for me, and just makes me a more well and whole person, which then translates to being able to provide better um, nursing care when you're at work.
Thank you.
Thanks, Heather. Christian, do you want to ask your question?
Yeah. So thank you all for taking the time, first of all. My question is kind of to the panelists of nursing residents currently. So in hearing kind of your guys' conversations about what you thought of the application process and what you would do differently, et cetera, I'm kind of identifying a few commonalities between the four of y'all, mainly being kind of like attention to detail, passion for care, um, things that I think that we can kind of associate with like the typical nursing student, so to speak. But my question is, how, after you have gone into the program, how have you found that some of those personality traits, maybe that aren't so strong in you personally, have been challenged? And challenged given the diversity of perspective and experience of your cohort members?
All right, good question. Madison, do you want to start?
So if I'm hearing that correctly, kind of just how have we been challenged personally starting on the floor? Is that correct, Christian?
Well, more so, what did you kind of experience that you needed to grow in more so than just kind of those areas that I said we kind of can see most nursing students are like?
Yeah. I think something that I've really had to grow on is that I think I did work in an emergency department beforehand while I was in school, and the being a nursing assistant or being a tech, you don't realize how much more that in the nursing role that you do have to do. I think we always say, yeah, time management, being able to have so much going on in your brain. You have multiple patients. And I think one of the main things is prioritization, especially in my department. Prioritization is extremely important. And I'll even have my preceptors saying, okay, we just got report on our patients. Who are you seeing first? And they really like to challenge me in that way. And there's so many different parts of the patient. One patient might have a really complex oncology diagnosis, but at that time they may be stable as someone that may have a very not really have that much of a past medical history, but at this moment they're not super stable. So I would say one of the main things that stuck out to me that I'm challenged with is prioritization, but I always feel supported by my preceptors and even the nurses in my zone that aren't my preceptors to challenge me. And I know sometimes when you first get that question, you're like, oh, do I know the right answer? It's okay to not have the right answer all the time, but they will be asking you, they will be challenging you, but that's how I learn best. I'm not going to learn best by getting it right the first time. It's going to be by someone challenging me and having to critically think about the answer, what patient I'm going to see next, or how I'm going to organize my tasks to be the most efficient.
Thanks, Madison. Vanessa, did you have a question?
Yes, thank you. Thank you so much for having me. My questions are for the nurse residents right now, and I think just in general. I just kind of wanted to know what elements of the program prepared you the most for transitioning into a professional nursing role, and what do you think sets Stanford apart from others? I just kind of want to know, what do you think is the best aspect of the program?
Thanks, Vanessa. Libby, do you want to take this one?
Yeah. Okay. So I think it's worth noting that we are also still with our preceptors at this moment. We're not on our own quite yet. At the end of this month, we will have something called a mentorship day. And that is where you are still on orientation, you're still with your preceptor, but it's one day for you to just trial and error. How are you going to do on your own? You still have your preceptor there. They're kind of what I think is just sitting pretty and waiting for you to ask a question or something, but you're in charge of your patients. Like I said, that's at the end of this month. In terms of what's going on right now, I have noticed both of my preceptors, I have two, individually, and they, without saying, they're just kind of giving me the roles to do. Like we get morning report in at 6:45 or something, and then I write down my notes. What are the patients? What are their meds? What's their history? And originally, they'll say, kind of like you said, Madison, who are you going to see first? And then it's super helpful for you to just walk through your thoughts with them. And at this point, it's just kind of like, yeah, we're talking together. We're teammating this. And then as the day goes on, for sure, if your nurse is okay and comfortable with you doing this, they let you take the lead, kind of, but without them saying it. So I've called both of my preceptors on it, and I said, "You're letting me do this on my own, aren't you?" And both of them said, "Yeah, no, it's about that time." So I think that's definitely preparing me for in a month, and I really appreciate that because you don't want to just be cut cold turkey, right? And so what was the other part of your question? What sets Stanford apart?
Yes, I was just
Okay.
wondering, like what you thought sets them apart. What do you think is like the big difference?
Unfortunately, I don't have experience at other hospitals in terms of like working there. But what I've noticed here is, well, we've got the union, which is really, really nice, and they'll talk to you about it once you are having your hiring process. And having that backing as well is super nice. I think other hospitals in the area have it as well, though, so I'm not sure.
That might be a harder question to answer.
Yeah.
That was awesome. Thank you so much.
Oh yeah.
Yeah,
There you go.
that's really what you gave me a lot of info. So thank you so much.
Thanks, Vanessa. Anita, I think you had your hand up.
Yes, thank you for having when I learned so much. I am an international BSN and MSN nurse. I graduated 2008, but I have zero experience in the US. I just got my California license and I just want to know, am I eligible for this program?
Have you put that in the chat yet?
I did.
Okay, good. So they will answer you there. I'm going to stick to questions because we have a huge group right now that are strictly for the panelists, okay? If they don't end up getting to you, Anita, you can go ahead and email newgradrn@stanfordhealthcare.org, okay?
Thank you so much for the information.
Okay. Yeah, absolutely. Okay, I'm going to move on for the next question here for our panelists. Let's see here. Jia, am I saying it? I'm not saying it correctly at all, but.
Yeah, because I originally come from China, so sorry for my accent. Maybe my English is not really pure one.
No, you're fine.
Yeah, so I'm more focused on the application questions because I feel that's according to the four pioneer who told me, I feel that's the key point for me to apply for this job. So I have question about those questions. So according to those questions, it's pretty detailed, ask like what I experienced in my life and all this stuff. But how about when we answer those questions, do we need to relate it like some nursing detail, like what we learn from the school, like something like justice, autonomy, and then beneficence, like those stuff, or we just talking about our own experience? Like we don't need to like relate it with any nursing knowledge, background, and some practical stuff. And like what you want from us is more like our personal feelings or more like professional expression. That's what I want to know.
Good question. I'll take that one for the residents. So yes, you don't need to put your nursing knowledge. We don't need to know the specific pathophysiology or anything like that. These are going to be simply the things that you have learned, the things that you have grown from, your experiences, your personal experiences.
Thank you so much.
Okay, you're very welcome. You're very welcome. Now I know we're out of order here with questions. I cannot figure out whose hand went up first. So I'm just kind of going from my screen. So I apologize if you're waiting a little bit longer. But Kathleen, you are in front, so I'll let you go next.
Hi, this is actually a very simple question. Basically, what part of the application did the new grads spend the most time on? Like, did you guys spend more time on the questions or your cover letter or your resume? So I'm sure it's probably different for everyone, but just out of curiosity.
Okay, great question. Elise, do you want to take that one?
Yeah, I think probably the application questions, because those are Stanford specific. I do recommend like tailoring your resume to like different programs too. Because sometimes when people like submit it in one format, like some hospitals would prefer it a different way. So definitely personalize every application and every cover letter. I think for most of my cover letters, like the block about me was the same, but like I would do research on the hospital and see how like what I wanted from a hospital related to Stanford. And yeah, so the cover letter and then the application questions, I think we can all agree that those were the ones that we just wrote again and again. So probably
probably those.
Thank you.
Thank you. Jer, do you want to go ahead and ask the residents a question? Oh, we can't hear you. You might be muted still. Jer, I'm going to come back to you in 1 second. Athena?
Hello, I just wanted to say thank you for hosting and answering all our questions. I know that Madison mentioned that one of her biggest challenges has been prioritization, but I wanted to see what has been the biggest challenge you faced transitioning from student to nurse or new grad.
Thank you. Heather, do you want to take that one?
Sure. I agree with Addison. Prioritization is challenging, and she mentioned that nurses are responsible for more than she initially anticipated or realized. I would agree with that. I think the other thing I would add is, and this is very cliche, but acknowledging up front that it will take time to get where you want to be. I'm very impatient. I want to be there already. I want to already be a great nurse. And 6 weeks of being on the floor, you're not going to be like as great of a nurse as you want to be in 6 weeks. And so I think prepping with that mental framework and going in with an attitude of learning, but also patience, and recognizing that it will be an iterative process and it will take time, I think has been super helpful for me. And the unit is very supportive and they will echo that. You are still learning. You will get there. It does take time, but that's okay. And that's what we expect. And you are on track. They mentioned the TCM model, like you are on track to getting where you want to be. And it's okay, you're not there yet.
Thank you so much.
Thanks, Heather. Hi, Jer. I'll come back to you now. No, I don't think so. You might need to put your question in the chat, okay? All right, Vipindeep, do you have a question for the residents?
Yes, I do have a question.
Okay, go ahead.
So, my name is Vipindeep. So, I graduated from India in 21 to 2012, and I took my test last month and I passed. But I has experience as an LVN. Now I'm pursuing my BSN, like from RN to BSN. So, will I be eligible for this program or not?
That is actually a question for the chat, not for the residents. They won't have that information, so I'll ask you to place it there, okay?
Okay, thank you so much.
Thank you. Imani, do you have a question for the residents?
Yes, are you guys able to hear me?
Yes.
So I actually have two questions. One of them is as far as like the application preparation and the questions versus like preparing for the interview, like does any of those questions kind of correlate or come up again if you guys noticed? And then my other question is kind of like, how are you guys just personally being able to sustain that waiting period from application to like interview invites?
Good question. Madison, do you want to take that?
Yes. So I would say that the questions do correlate. I know that in the interview webinar, they'll lay out all of the different traits of a nurse, and obviously there's so many, but I think that they're always going to be interconnected. Um, in and I think that I guess a specific example is that the question about an error in judgment, I was asked that in my in-person interview. And I did talk about the same situation because it is something that has really impacted me and my practice. And would encourage everyone, especially in that question, to really reflect on it, be vulnerable about it. We are not perfect. It is okay to admit to an error in judgment. This is an application essay. You might not want to do the cliche, oh, I sometimes take on too much, or like I can't say no. Maybe try and think a little bit deeper and know that it's okay to admit to an error in judgment, because that is how we learn. And I talked about the same situation in my in-person interview, and I really do think that that's when I was able to really create a connection with the panel that I was interviewing with in person, because they were able to sense and feel my sincerity about the situation and see that I do have a growth mindset and I'm always wanting to improve and learn from any sort of mistakes that I've made. And then second question was sorry, could you?
Yeah, how did you manage that wait time between after applying?
Yes.
Because it's a pretty lengthy period. Like, what was your
Yes.
mindset? How were you thinking? Were you trying to just keep positive thoughts? How did you guys manage that?
I think that it's really helpful that it's laid out for you. They tell you when the timeline is. So it's not that you hear oh, okay, we'll get back to you in a few weeks. You know exactly when it's going to happen. So I think that that is really helpful. I would say what helped me during that time is that I was able to say, I spent time on my application. I did my best, but I was also able to think, okay, they're looking at these applications for 2 months. That really means that they are diving deep into all of our applications. They're not just scanning it really briefly and throwing it in the trash. Stanford gets a lot of applications, but they are truly taking the time to look at it from a holistic approach and really see who is going to be able to align with Stanford's values as a nurse and who wants to be at Stanford.
Thanks, Madison. Angelica, did you have a question for the residents?
Yes, good morning. Thank you for hosting. This is specific to the panelists in regards to the application questions. I just wanted to know the average length of each answer that that they had submitted into the application, and just kind of having a good reference for when we apply.
Thank you. Libby, do you want to answer that?
Yes, I'm glad you brought that up. Because, well, the quick answer to that is it was about a half a page for each answer. But it also depends on the question too. If you're resonating with a question a lot, make it a little bit longer so it's gonna shine, right? It's that special one for you. But then what I also wanted to bring up, and you've probably been hearing it as you prep for interviews and such, is the STAR method, and making sure that you talk about the situation, task, action, result, right? And you're going to hear that over and over again. But in your stories, I would say make it exactly that, right? You have your situation, set the scene, okay? And then how are you feeling in that? Making sure that you are like immersing your readers in that moment. And it makes it more exciting to read. And then obviously, talk about the main content. What is the problem? How are you relating that to the question? And then at the end, what did you learn? What's your reflection on that? That's huge. That's where they're going to say, oh, like this makes sense. This is a really good essay answer. Just like when you were learning in school how to write, right? This applies also in the essay questions. And so with all of that together, I broke it down with a couple paragraphs. It was about a half page.
Thank you.
Thanks, Libby. And I would just reiterate the importance of ensuring that you are answering the questions. So use your STAR method, but also make sure you're answering the questions too, and you're capturing that information. So we only have a few minutes left. So I'm going to take probably one, if not two more questions. What I want to really do just for a sec while we take these questions is, can you see my page okay? Okay. I wanted just to show the, if you have further questions and anything else comes up, I wanted just to put this up for a couple minutes. The link, the QR code at the top is the link to our career site so that you can ask questions, review information, critical dates. Again, if you scroll to the bottom, then you will have the opportunity for some frequently asked questions that we get around cover letters and resumes and applications. And then if you have a burning question that isn't there, you can email newgradrn@stanfordhealthcare.org, and they can help to potentially answer that for you. If they can't, they'll reach out to us. And then also for important news and announcements, our Instagram and LinkedIn. So those are all options for you guys. So what I'm going to do here is, when I'm sharing my screen, it's a little more difficult to see, but ML, did you have a question?
Yeah, as a new ADN nurse, we're in the position to be shopping around for new grad programs and pursue a BSN at the same time. Would you say that this program would allow kind of that wiggle room to be able to do both? Like, is it too much of a workload to be in a BSN program at the same time?
I'm not sure if any of our residents that I have on right now started with their ADN and are pursuing the BSN. I don't think so, but I can say that from the experience of others that they were able to manage both at the same time. It's a lot of work, but they're able to manage it. Thank you for your question. Let's see. Who's next? Laurel, did we get to you yet?
No, I just had a question. The panelists pretty much talked about it, but I wanted more information since we're right now just like solely focusing on the application process. I would like to know more of like tips and tricks that they have for us if we reach to getting the panel interviews.
Okay, Elise, did you want to take that one?
Yeah. I like Maddie said, putting it together, I think these application questions are kind of like situations, and a lot of the interview questions for both rounds were like situations. So my advice if you're still in school is to like keep a journal and talk about patient cases that you remember and what you learned from them and keep them in your back pocket for interviews. Because it's a lot of like, tell me about a time when, or tell me about a situation in which you learn XYZ. So make sure that you're writing down like every day, what did I learn? Who did I see? What kind of connections did I make with my patients? And then bring those back up, and then you can kind of put them in that star or car format when it's time for the interview. Yeah, a lot of Stanford is taking from your past experiences, so make sure that you remember those for later.
Thank you so
much. Thank you. All right, everyone. Well, we are at our time, and I want to be mindful of the time commitment of our residents gave us today. I want to thank you all for joining us. Again, you have access to our careers page, our Instagram and LinkedIn. So if you have any further questions, please don't hesitate to reach out. Again, thank you everyone for your time today. It was great to connect with you. Have a great rest of your day. Bye.
Thank you.
Thank you.
Bye-bye.
Thank you so much.
Thank you.